So welcome everyone to the University of Behavioral Health, UBH CEU, presented by Dr. Malone. We're very excited to have you all with us today. I'm sure we'll have more people joining us as we go here. Dr. Malone's been practicing medicine. Correct me if I do any of this wrong, Dr. Malone, but 38 years? 38 years?
I've been doing inpatient psychiatry 42 years.
42 years. There you go. 42 years. He's got background in psychiatry, neurology, addiction medicine. Well recommended and renowned by his colleagues, Doctor of the Year for the last 15 years. Loved by the adolescents here at UBH. And really, we're just grateful to have him with us at UBH. He's also a medical director at Texas Health Recovery and Wellness Center in Mansfield in the past, and Arlington Memorial. He's a professor at UT Southwestern. Even told me yesterday he's done some of these Zoom sessions. So we're really lucky to have him with us today and be presenting for us. Dr. Malone, I'm going to share the screen and kick it over to you if you're ready.
I'm ready.
All right.
And thank you and welcome everybody here, taking time out of your day to come to this meeting. See, my screen just changed. Oh, there we go. Let me see where I am. I've just been visiting with Liz Young, an old friend. There's a lot of old friends out there. I saw the list, and I know people are kind of hungry for information. I always do these things personally, just face to face with the audience. It's hard for me to see people out there. Always honored to be asked. As Katie was saying, I'm board certified in general psychiatry, addiction psychiatry, and psychoanalysis. So I've got a broad span here. I do adolescent work here. That was what they needed me to do. So that's why I'm here to do that work. I'm at University of Behavioral Health in Denton, a very good hospital. It's a busy place, runs 60, 70 patients. Top flight administrative staff. We have really good floor staff. So we do a good job managing the patient volume here. And I'm honored to be asked to do this. This is kind of a radioactive topic. Everybody's interested in this, but nobody wants to talk about it because it's very controversial. People are fighting over this. I'm not going to have any fight. This is going to be a fact-based talk. The information I'm going to give you is from the National Institute of Health, National Institute of Mental Health, and National Institute of Drug Abuse. What they do is they take studies, they find the studies that are valid, they compress them, they get up to 10,000 people that are involved, and they come up with trends and go, this is what we think is happening. They study us like bugs in a lab. They don't care which bug wins. So I'm going to just give you the facts as I see them, plus my clinical experience, my background in addiction psychiatry, my background in psychoanalysis of families. And we'll talk a little about the legal stuff, but I have no control over that. So we're going to focus on this as a clinical talk. And I'm really glad to have people willing to come in and hear this talk. The controversy is a lot of it has to do with the fact that it's going to become legal. That's going to upset a lot of people in Texas. You can get it anyway. It's everywhere. The kids can get it whenever they want to. I had a patient come in and say they went to the liquor store, which was a therapy issue, by the way, and on the front shelf was THC infused vodka. Buy it off the shelf. We're talking about marijuana, which is weed or pot. We're going to talk about a little hashish, which has been around forever, which is very condensed form of marijuana, very intense. Butter, been around for a bit. That's another condensed form. Shatter, that's the new one. It's 50 times more potent than marijuana. You bake it at a party. And we're also going to get into hemp and CBD. Now, those are slightly different. I can almost see a CBD shop from here. And I went by this morning and have a full parking lot. And they're everywhere. It's big business, big business. I gave this talk at the Rotary Club 2 years ago in Fort Worth, 2 years ago. And I was kind of set up because all the people, the Rotary Club were investing in hemp and CBD, and they wanted a little bit of a counterpoint and brought me in. I thought I was going to get protection to get me out. But this is coming too. Hemp is actually the second fastest growing substance on earth. The only thing grows faster is bamboo. Use it for paper, use it for rope, use it for toilet paper. We have to chop down fewer trees. That's a good idea, chopping down fewer trees. But so what they used to make CBD. And I'll say right up front, there are 70 cannabinoids, 70, and only one of them THC. CBD, it comes from hemp that has less THC, but not none. So that becomes an issue, by the way, is that it's not FDA approved. The product's there's no quality controls. Almost all the CBD oil you buy also has THC in it. Probably heard the story. TSA agent out at the airport has shoulder pain, goes to CBD oil, rubs it on the shoulder, gets better.
Karen, RN, please dial 8114.
I'm sorry, I'm getting someone else visiting with us here. So he goes in for his annual physical and urine's positive for THC. He is fired. He's 53 years old. That's it, no appeal. We live in an environment that's highly conflicted. Most jobs in Texas, you cannot have THC in your urine to get the job. Most people are in jobs right now that you had to get a urine drug test to start. So that's the environment we live in. Don't shoot the messenger. I'm just going to go through all this stuff. Now, social culture is always very helpful. I always bring this along. It's kind of funny, sort of. I have a patient who's in recovery, and he decided to take a cruise to Alaska. So you fly to Seattle. So he gets to the day before and gets out, and they go around the Pike Market. I'm touring around Pike Market, nice place, all fish and stuff. So, and he always, by the way, if anybody knows about recovery, he always asks, is there a meeting of the Friends of Bill W? They can't say there's an AA meeting because it runs off the other customers. So he finds a recovery meeting on the cruise ship. So he feels safe, but he has issues with alcohol, marijuana, and cocaine. So he gets off at the Pike Market and at the airport, gets out, and he gets this brochure, Washington Cannabis Tourism Map. And I think it's an interesting map. I'll show you a little bit of it because here you are. Okay, here we're in Seattle. So here's this map right here. So it shows all the marijuana shops and cannabinoid shops that are in Seattle. And it says you're walking down the street, and there's people every 10 feet that have a little bucket that says need bud. So you want to give them money so you can buy bud. And this map is so that if you're too stoned to find the next marijuana shop, you have this map to help you. This is just what's happening now. And what he said to me was kind of, I thought, useful, that because he has a military background. Said, Seattle, if we were having conflicts with China and North Korea, said, that a land invasion, it came into Seattle, what is the chance of getting militia among these people? That's a social question. Interesting question. This is our culture. My wife and I went to the Columbia River Gorge about 2 years ago. Beautiful. It's good for old people. Stayed at the Bridge of the Gods. Just drive around, look at waterfalls, just about the coolest thing ever. But you get out, and I went to rent my car, and a giant sign said no cash. Well, that's weird. And so then I go to get a map and buy some, candy bars at the gas station. Giant sign says no cash. Okay. Get to the hotel. Now the Bridge of the Gods, middle of nowhere. And you walk in, giant sign says no cash. And so what's going on here? So I buy a Portland newspaper, and this is the conflict in Portland. The biggest business is marijuana sales. And but it's actually it's locally and state legal. It is illegal federally. You can't move the money. No one will take the cash because then they're in the chain. It reminds me of, you remember Scarface, back in the 80s, the cocaine in Miami, that 80% of the $100 bills in Miami during that time had traces of cocaine. So we're going through that kind of a boom here. A friend of mine, attorney, had a great practice in Fort Worth, just moved to Boulder. What's he doing in Boulder? Just a little oil and gas stuff. This is going to get into this. We're going to get into what's happening is that the boom business in Colorado, because some people smoke marijuana, is attorneys and car wrecks. You ever see those billboards on the freeway? Car wreck, call this guy, car wreck cowboy, I'm the hammer, all that kind of stuff. What they're looking for, the cases they want, is a car wreck where one person is positive for marijuana and the other person is not. Because we're going to get into this, hand-eye coordination is off. The person who's positive for marijuana loses a case, big lawsuits. What they want is your 70-year-old kid's got marijuana in their system, driving a car you bought for them. They wreck, hurt somebody. and that family sues you for a gazillion dollars. That's the growth industry. So just how common is this? It's most common in young adults and adolescents. From 13 to 25, the estimation is 30% use marijuana regularly. I think it's underestimated. It's everywhere. And they say 4 to 8% use daily. And that's in the realm of like 12 million. A friend of mine knew I was doing this talk, and he actually has a tighter practice than I have. I work in the hospital. People know me. I'm a psychoanalyst. I have an office in Grapevine where I see therapy patients, the outpatients. But he drug tests all the people coming to his practice just to be safe. 30% of his patients are positive for THC. In our hospital, we do drug screens on everybody. 50% of the adolescents are positive for THC. I think we have a test. I think a test is off. I think it's more than that. If you get over 25, the number runs 10 to 12%, which is kind of that's normal. And what you want to know, there's the casual use of marijuana, the occasional use of marijuana. And we're talking about, is there a normal recreational use? We'll talk about that. But for folks of us in the addiction field, there's 25% of people have a genetically determined disorder, 18% have anxiety disorder, 13% have depression, 8% have addictions, 3% have bipolar, 1% have schizophrenia. These are genetic illnesses. And so the number of people in any given population in the United States is roughly 8% have addictive illnesses. And about 8 to 10% of adults smoke marijuana. So I'm going to attempt to do the next slide. Katie, help me. Oh, please work. Oh, there you go. Okay, we're going to do the history.
Dr. Malone, do you see the poll on the screen?
No, what did it say?
It says of client use. We put the first question up there. Do you have clients that use marijuana in that discussion you were just using? And 87%, 47 people said yes, and 7 people said unsure. 0 said no.
Well, see, that's pretty accurate. This is just like, and again, we're gonna have marijuana in the and vending machines in the 7-Elevens. You can go to a liquor store now and get vodka infused with THC. It's everywhere. There you go. Okay. That's a strong number. So let's talk about history for a bit. Marijuana has been known to be used for at least 2,500 years BC, 2,500 BC in China. It spread to India, spread around the world. And this is an important concept here. It was used medicinally. It was used for analgesia, for pain, used for insomnia, for sleep. It works for those. We'll get into that. It works for the cost. And I studied medicine in the United States during the 1800s, from the time the country was formed till about 1900. The most common medicine used for that was alcohol. In fact, most people brewed their own beer, and they had a beer for breakfast, beer for lunch, beer for dinner, and then 2 beers to sleep. That was all you had. We didn't have psychotherapy. We didn't have medications. You went to the doctor, told them you're stressed out. You go join the club, get out there. Now, these are the numbers that are helpful. The life expectancy in 1900 in the United States was 46. The life expectancy in 2000 was 78. What happened? Well, number one, nutrition. A lot of people started working doors too, by the way. Number 2 is modern medicine. And number 3 is vaccines. So you get an opportunity to get a vaccine, get one, so you live. But modern medicine started treating pain and sleep problems and anxiety problems and all the stuff we're going to get into. I have reefer madness up on the board. Now, in the 30s United States, this came out in 1936, reefer madness. And it was designed to scare people away from marijuana because it's starting to come in from the South. We have cattle ranch. The vaqueros come up from Mexico, salt of the earth people, just great to work with. And they often carry marijuana with them in the 60s, and I'd never seen it before. But Reefer Madness, I saw this movie. I saw 2 movies in my teenage years that affected me. One, Reefer Madness, which was an absurd movie. You should watch it. If you smoke marijuana, you go crazy, you start laughing hysterically, you go rape a man or a woman, you rob a bank, you go psychotic and kill yourself. And it was absurd. And so my generation said, the adults are trying to scare us off of this because it's fun. And this is the problem with misinformation. That's why you stick with correct information. Reefer madness floats around now. It's kind of a joke. Oops. Oh, there you go. In the 60s, when I was growing up, marijuana exploded. It was counterculture. You're against Nixon in the war, you smoke marijuana. I saw reefer madness. I saw Woodstock. Man, this looked like fun. They're all running around, listening to Jimi Hendrix, smoking marijuana, not wearing any clothing. I want to be that guy. They didn't tell you the downside. That was kind of the stuff we had there. And the question I had, I asked my dad, well, Dad, what do they do the day after Woodstock closed? What do they do? Do these guys have jobs or something? They go to school or go back to work? Because that wasn't life. It's like I went to Big Sur, visited the Henry Miller Museum. He wrote Tropic of Cancer. About all these people lived there and they just drank and had sex all the time and stuff. Is that fulfilling? That was the question I had. Was if you just went to Woodstock, I remember the guy Wavy Gravy, remember that character? He was from Woodstock. He said that's how he lived forever. And Ken Kesey, people like that. I don't know. Any of us could live that life and chose not to because it was not fulfilling. The thing that actually entered here, we have the war on drugs, and what occurred was we started spraying paraquat on the marijuana in Mexico. I saw that in medical school. It corrosives your lungs. They spray the crops in Mexico, and then they'd harvest it immediately and sell it. And we started realizing marijuana is not just a harmless herb. There are impurities in marijuana. If you smoke marijuana, it's 10 times more tar and impurities than there is in cigarettes. You'll start wondering if you start having lung problems. I give you the answer to that. All my friends who started smoking marijuana every day in high school died. Life expectancy on marijuana, I will tell you, smoke every single day is 52 from emphysema or lung cancer. So sorry. That's a fact. Go to the National Institute of Health website and you'll find this stuff. As we push forward, they started spiking the marijuana, even the stuff that comes from Colorado, hydroponically grown, still has all the impurities in it. But put K2, PCP, and ecstasy in marijuana. And so we started seeing kids coming in who were psychotic. Some of these kids had a genetic risk for psychosis, some did not. And if any of us take angel dust or K2 or ecstasy, or you, what I read in the 70s, Carlos Castaneda, Yaki Guide to Knowledge, where you do a vision quest, you go eat poet, eat buttons, you'll go psychotic. Now, if you're in a controlled setting, that maybe that does you some good. They're using psychedelics now for PTSD and head injury. That's a whole nother talk. But for the most part, it's not good for you. It's not good for the brains of teenagers, for sure. We're going to get into that. And what's happening now? This is a modern trend. You go, well, let's make marijuana legal, and then the nice hippies in Colorado wearing tie-dye shirts are selling it. That's not what's happening. You go to Colorado, it's all owned by Monsanto and Del Monte. They're doing this. Once it is completely legal, we're talking about CBD in a minute. CBD is not regulated. They're going to have, Pfizer and Moderna are going to be making CBD. We want them to, so they make a pure product. The product right now is impure. Again, the prevalence under 25 is about 30%, 4% daily. Over 25, it dropped to 10%. Why? Well, one thing, you're self-medicating. We're going to get into some with your self-medicating, which gets better. There are others who have a JOB. You can't smoke marijuana and do most jobs. They're going to test you, and you're not going to perform well. And just the worldview on this, his prevalence, worldview. Here we go. I've gotten interested in studying this. It's kind of fun to study. Amsterdam turned into marijuana haven. It's funny. Those businesses are shutting down now because marijuana is now legal everywhere. So you don't have to go to Amsterdam to get it. That's one thing. And people are kind of sick of it over there. But I saw one of my favorite things was a documentary on religions, and they went to Amsterdam and they have a church of cannabis. It's actually true. I wouldn't make this up. And they go to the Church of Canada, this old, church in Amsterdam, and they go in and they have stained glass windows of marijuana plants and stuff. And so it's a dark room like candles. And so the guy goes to interview the high priest of cannabis, and he sits down, starts talking. So it's a very spiritual experience, and he was very high. Starts talking about it, he leans back, and the interviewer looks and goes, "Sir, your hair's on fire." And I goes, "What? What?" He doesn't know his hair's on fire. So they put his hair out. And he says to him, "This is not a very good endorsement of your product, that if you're using it, you don't know your hair's on fire." I'm sorry, it's not funny. These are the real issues here, is that most of us, I would say, we're in the behavioral health business. You want to be authentic, know how you feel. You want to be in touch with your cognitive mind. You want to be spiritual, have self-love and love to give. You have to be cogent. I don't want to take something I don't know my hair's on fire. It was very impressive to see that, by the way. And I'm sure as the church is still there. Oops. Oh, there you go. So that's kind of the current landscape. I will say too, pharmacologically, you have to just remember, any substance that works in your body or on the brain has at least 3 effects: 3, the desired effect and 2 side effects. Cannabinoids are kind of like nicotinic receptors. Cannabinoid receptors are throughout your brain and spinal cord. That's why, by the way, nicotine is the most addictive substance on the face of the earth. You can get addicted on 1 dose. With high dose opiates, it's 5 days. Alcohol benzos is 2 weeks. You can get addicted to cannabinoids. You can get addicted. Sorry, everybody says general substance safe, can't get addicted. You use every day for 6 months, 30% are addicted. What that means is, if you stop using it, you go through a withdrawal phenomenon and you get emotionally and psychologically destabilized. That's addiction. You don't have seizures. It's sort of like coming off of cocaine, amphetamine, stimulants. The hemp, which turns into CBD, is supposed to not have THC, but it usually does. The advantage of that is that you can get a product that is delivered to you in an ointment or oil form that actually has some anti-inflammatory effect directly to a joint. And supposedly you do not get the THC until the FDA takes over, until Monsanto and Pfizer, whoever makes this stuff, can make sure that the THC is not in it. You run the risk of all the other problems you have with marijuana. What does it affect? Hippocampus, nucleus accumbens, all your pleasure centers, or your septal nucleus, your ventral tegmental nucleus, your nucleus accumbens, primarily affected by cannabinoids. Your cortex slows down thought process, cerebellum, involved in coordination. You get clumsy, you fall down, it's comical. That's what's happening to you unless you drive a car. Frontal lobe, you can get frontal lobe syndrome throughout your brain and spinal cord. Oops. Oh, there you go. Which takes us into what are called medicinal uses of marijuana and CBD, because everyone says, oh, this is my medicine. It's legal in Colorado, it's my medication. So we're going to walk through why people use marijuana and CBD. Number 1 is pain. I'm a member of the American Academy of Pain Management. I do non-narcotic pain management because I do addiction psychiatry. People come in addicted to different substances trying to treat their pain. Marijuana is a pretty good pain treatment. CBD is slightly better. CBD is good for spot treatment. Marijuana is good for all over, but only for 3 hours. There's a short term on that. We won't spend that much time on this today. I'm going to talk about it all the whole time. Non-narcotic pain management, you get off all addictive substances. I get you on a grouping of medicines that lower pain, antidepressant, mood stabilizers. We get in recovery if you need to, do psychotherapy, resolve your emotional conflicts. Then we teach people lifestyle changes, biofeedback hypnosis, EMDR. It works about 60% of the time. People are off pain medicines, get their pain below a 3, and move on with their life. Most thankful patients I have, they won't go away. They keep coming back just because I'm like the guy that pulls a thorn out of your paw. There's an alternative for that. Anxiety, marijuana is good for anxiety for about 3 hours. And then you have to really be focused on this. The anxiety goes away in marijuana 3 to 4 hours. Then it comes back. And it does not actually last. Depression, same thing. Is it for 3 or 4 hours you're not depressed? You have to get a certain level in your blood to get high. It actually makes you more depressed over time. Sleep, the two problems people come in with, initial sleep disturbance is generally anxiety. You either have an emotional conflict driving the anxiety, or you have an anxiety disorder. Initial sleep disturbance, you can't go to sleep for 1 or 2 hours. Marijuana is somewhat helpful with that. It is not helpful for a terminal sleep disturbance where you sleep about 4 hours and then wake up. That is caused by depression, and marijuana does not help with that. I have medicines that fix that. The things it actually helps with, intractable vomiting. I have, in the last 2 years, prescribed a patient Marinol. Marinol is a marijuana pill that helps people with intractable vomiting. I was treating a woman who had terminal cancer. She was dying, and all the traditional medicines did not help. So I gave her Marinol, and her vomiting stopped. That actually works. So, I mean, this is not saying there's no good medicines and bad medicines. These are just chemicals. THC works for this, and that's a reasonable reason to use it. Seizures, this comes up a lot. There are 2 seizure disorders, Dravet syndrome and Lennox-Gastaut syndrome in children that only respond to THC. They're bizarrely rare. I started medical school 45 years ago, 46 years ago, lose track of time. I've never seen or heard of this in clinical practice. So these are extremely rare. Otherwise, it has no impact on that. And plus, you get something that has K2 in it, you're gonna have a seizure. Multiple sclerosis is touted for that. My wife has multiple sclerosis. She hadn't used it. I have many friends with multiple sclerosis. When they take this, it clouds their sensorium, makes them more clumsy. No one says they want that. ALS is touted for ALS. A friend of mine died of ALS, Lou Gehrig's disease. He tried it. He was clumsy. He was not cogent. It did not help. He didn't take it. Parkinsonism. Parkinsonism, the biggest risk, you go psychotic. So if you take marijuana, you'd be more psychotic. I've never seen it help anyone with Parkinsonism. Narrow angle glaucoma. Now in the 80s, you get a prescription from the National Institute of Health for marijuana if you had narrow angle glaucoma. It works. Right now we see fourth line treatment for narrow angle glaucoma. The first 3 treatments work. It's not needed for that. I have narrow angle glaucoma in my family. It is used in terminal patients. I have no issue with terminal patients getting this. Terminal patients get whatever they want. I would say, however, you have to decide for yourself, do you want to leave this world clouded or cogent? I've been around several hundred deaths, been in hospitals for a long time. I've been around families that died. My mother died 10 years ago over at All Saints, and she wanted me there. It was a very profound experience. I won't get too deep into it because it was overwhelming to be there with her. She was cogent to describe what she saw. How do you want to leave this world? And on top of that, this is a whole other topic. You know, this is all role modeling. Your last gift to give your children is to die well. Think about that for a second. We parent the way we're parented, we will die the way our parents died. They were screaming, "Oh God, why me?" That's how they're going to die too. My mother went out with dignity and kind of gave me that gift, her last gift. This gets to the whole process of this, is that you have anxiety, depression, you have feelings. If they're overwhelming, you can go to therapy or take medicine, but this is part of the human experience, part of who you are. To be your authentic self, you feel things. We live in our cognitive minds, and that's actually is affected by these substances. Now, I'll say something else that is very difficult to talk about. I'll say it real quickly. Intractable vomiting. 20 to 30% of pregnant women smoke marijuana. In California, it's higher because it's fine. You calm down, your baby calms down, everybody's happy. Okay. This is the known facts about that. It blocks nutrients going through the placenta. You have low birth weight. This is not Dr. Malone. You go to the National Institute of Health website, you'll find this. The fetus has 10% of the cannabinoid level of the mother. It inhibits the growth of neurological development, including the cortex and the hippocampus. Those children have learning disabilities. They're stunted growth, learning disabilities. why would you do this to your fetus? What is so important that you need to smoke marijuana and cause this? I don't, I have a grandbaby now, born last year, and I couldn't be with the delivery. I went to see my daughter the next week and came and she's holding this tiny, tiny creature and handed it to me. I hold it in one hand, hold the baby in one hand. This precious, helpless. We're the adults. We're supposed to protect the kids. And our adolescent unit, I'm constantly fighting to protect the kids from themselves and their parents. Because if you do this stuff, it affects your brain, and sometimes they go away. I see fetal alcohol kids and people, mother took marijuana or took amphetamine. It's a life sentence. It never goes away. So I'm not sympathetic to this. Like thalidomide, you ever heard of that? Came out in the 50s. I can't say it, thalidomide. It stopped morning sickness. 1 in 100 kids are born without hands, feet, or genitalia. Is that a good trade-off? I saw thalidomide kids in medical school. There's no fix when that happens. I'm sorry, I'm getting more preachy here. Be careful. Oh, here we go. I love this one. This appears on the internet. Cannabis is illegal because it treats cancer, PTSD, seizures, anxiety, glaucoma, and depression, which means less money to the pharmaceutical companies. It is not the treatment of choice for any of these conditions: rare seizures, intractable vomiting. The pharmaceutical companies are going to start making money with CBD or marijuana anyway. This is capitalism. This is just a false statement. This is quoted to me all the time by the kids. Here's the psychological effects of good things to know. Okay, basic stuff. Loss of IQ. These are the costs. This is the upside of marijuana CBD, stuff that they treat, which is limited. This is the cost. If an adult smokes marijuana for 6 months every day, they will lose approximately 10 IQ points. If you stop, most of that comes back in 6 months. If an adolescent smokes marijuana every day, they'll lose 10 IQ points, and it does not return. The best study, if you're interested, is in New Zealand. They followed people who smoked marijuana as well as people that did not. At 35, their IQ was 10 points less. A life sentence. And just bear with me for a minute. Every adolescent has parents. I was reminded, what was that book? Tess of the D'Urbervilles. I always liked that book. And the thing you're supposed to learn from that, adolescents are like moth attracted to a flame and a lamp. We're supposed to put the bell jar over the lamp so they don't get burned up. We're abdicating our role to adapt to social culture. That's my last editorial thing. The New Zealand study is an absolute, really good study. You want to read about that. Amotivational syndrome, that's one word. Frontal lobe deposit, cannabinoids, and particularly THC deposit in fat cells, why you get a positive urine for 2 weeks to 4 weeks. And fat cells in your frontal lobe, you smoke enough, you get amotivational syndrome. What does that look like? Well, somebody's got little Freddy's at home, smokes marijuana all day, sits on the couch, eats goldfish, you weigh 300 pounds. That's amotivational syndrome. That's not a joke. Everybody knows somebody like that. That will come out of your brain in about 6 months. And all my friends smoke marijuana every day. They felt like Rip Van Winkle, like they woke up in 6 months, like what's been going on here? Not feeling your whole life and not being able to think is not a great way to go through life. Psychosis. High enough doses to cause psychosis in anybody. If you have bipolar or schizophrenia, and there are 8 subtypes of schizophrenia, certain subtypes of schizophrenia just take off flying with marijuana. And so if you have the genetic risk for schizophrenia, I had a patient who was just here, and he had some physical abuse, and he finally kind of went in therapy, doing well with that. His sister has schizophrenia, says his father is bipolar. So he and his friends smoke marijuana. He blacks out and beats up his parents, and they take him to real jail, adult jail, then to juvie, then to us. And his doctor, I don't remember what happened. And so we had to talk about his abuse issues. So he's experienced violence, propensity for violence. And he's hearing voices and seeing things. It brought out his psychotic illness. So it's a good test case, but if you have a genetic history, you think you gotta be careful. And I have genetics for several things, including chemical dependency runs in my family. I learned my lesson early. I'm still alive. I'm doing this talk, by the way. I'm not dead. There's a reason for that. It's all self-care. And the big argument, is this a gateway? Yes, it is. Marijuana and alcohol are a gateway for teenagers. If you smoke marijuana and you drink as a teenager, your three primary pleasure centers, your septal nucleus, your nucleus accumbens, your ventral tegmental nucleus are primed to want these substances. And if you're in the 8% that have the genetics, they'll want stronger substances. That's how you wind up going to other things. Doesn't cause it, it triggers it, but it also diverts from the things that which should create pleasure. Anyway, does recovery work. People get in recovery, nothing feels good or tastes good for about a year, and then your pleasure centers rewire to things that are supposed to feel good. Good day at work, good workout, romantic encounter, steak dinner, that starts to feel good again. It rewires. But if you prime the pump with these substances as a teenager, you set people up for this. Other neurological effects, we talked about the brain injury. Reaction times, this is fascinating. Because there may be some folks with military background out there. I was a big fan of a guy named Chuck Yeager. Everybody knows who he was. He flew the X-planes and broke the sound barrier. And as I watched that and studied those guys, they were out there being test pilots. And they couldn't go to therapy and they really couldn't take medicine. So they had a bar they went to and they drank. They drank too much. That was how they dealt with their stress. And that kind of got to be acceptable. And I remember in the 70s, the pilots were saying, look, we don't want to drink. We want to smoke marijuana. It calms us down. And I can't find this paper. It's in my, don't go to my house. My sacks of paper is filled up 3 or 4 rooms. But there's a paper I read. It's a really good study done by the military and the Air Force. And they wanted to say, okay, well, let's see if we can let these guys smoke marijuana. So they just checked the reaction times, hand-eye coordination. You see something, grab it. And what they found is that it reduces your reaction times by 0.2 of a second. How far can F-16 go in 0.2 of a second? How far can that F-35 go in 0.2 of a second? 0.2 of a second, they've hit the target, deliver it, and come back. So I said, no way. And so military, they're like Chuck Yeager's guys in Vietnam. No marijuana, no alcohol, because you want them to be sharp. Those are just microsecond decisions. Also, why you lose the lawsuit. We're not the only people that know this. The attorneys know this. If you're driving a car on marijuana and your reaction time for 0.2 seconds slower, it's your fault, and it flies. They win every lawsuit. And by the way, without going into it, I think, 80% of fatal car accidents, the person's either positive for alcohol or marijuana. That because your judgment is wrong and you physically can't do it. And other people out there have experience in athletics. You ever tried to go run a race or play basketball when you're drinking or on marijuana? You think you're going to do great. It's you can't do it. I've played guys like that. Oh, here's a good brain picture. Can't have a talk like this without a rat brain. The rat brain cut in half. What you see there's the nucleus accumbens, there's the cerebellum, cortex, distribution of cannabinoid receptors in the rat brain. Brain images reveal high levels, orange and yellow cannabinoid receptors in many areas, cortex, hippocampus, cerebellum, nucleus accumbens, and the ventral striatum. So they give the rats marijuana, cut their brains in half. We can't do that to kids, but we're all mammals. We have the same brain. This is where it all goes. This is where you live in this part of your brain. This is who you are. It's the essence of who you are being altered. Lung effects, 10 times more impurities in cigarettes and marijuana. There is cannabinoid specific carcinogenic effect on your lungs. This is being studied extensively. National Institute of Health, not Dr. Malone. That means there is something in cannabinoids that causes lung cancer more than just tobacco. Life expectancy is about 52 if you smoke cigarettes, and also they can't differentiate. So a lot of people smoke marijuana, smoke cigarettes. But here's some, this is trying to scare people. Don't scare people. Some lungs don't look so hot. if you want to get treatment, pretty straightforward. People come to me and goes, look, I need to get off alcohol, marijuana, cocaine, whatever. You stop using. You stop using. You feel like crap for a while. Then you have to get treatment. You have to treat the underlying condition, depression, anxiety, unresolved conflicts. I'm a psychoanalyst. You know what we do? We look at what is your genetic component, what is the unresolved conflicts you have, the internalized objects you have, what's the stress in your current life, how you're dealing with it. Education. Why aren't there talks like this all the time? Why is talk like this on television so the kids will know? I say these things, people think I've lost my mind. And this is published. I mean, this stuff's out there. I've run a residential program before. You go to residential, you double your chance of being sober. Here's the formula, secret formula for addiction. Detox, can be inpatient, can be outpatient, partial hospital, RTC if you can. Medications for sleep, anxiety, depression. AA and NA works free. You know, 100 chapters in Dallas Fort Worth. I can tell you what happens in every one of them. Get set up with that. Individual therapy to deal with your conflicts, your coping mechanism, family therapy. Now, the special problems with adolescents are, you know, I've gotten in trouble more at this facility by discussing with adolescents, hey, look, this marijuana is not good for you. They tell their parents call the administration and they complain because the family sits around and smokes marijuana all day. This is family medicine. Who am I to say anything about that? We're swimming upstream. Correct information speaks for itself. If I'm the messenger of correct information, I'll take the flak. But you can't tell somebody it's okay to do something that it's not. And if the people get mad at me, then so be it. But most people in the same boat, you're going to do treatment. You have to educate people and tell them there is treatment and go through life cogent. You get one pass here. Don't pay attention. You know, a lot of experiences are fun and a lot of them are surprises. You don't know when they're coming. Okay, follow up, the IQ and results in adults returns in 6 months, never in adolescents. Risk for lung cancer is there. So, marijuana CBD. CBD is untested. There are no real tests to tell you much about it. It's impure. When they get it in purified form, there's not an argument against using it for pain, unless you use it, and sometimes you use too much, and you can't think straight. You kind of measure that. All the cannabinoids work similarly. For really, other than that, it causes brain injury, lung injury, and you'll die of lung cancer in your 50s. Other treatments work better without these side effects. Now, I'm just the person passing this on. People choose for themselves. Everyone's on their own path. Now, people ask me about recreational use, and I'm not the person who will say that. I'm not the person who will say the recreational use is bad. And I'll say something else that's a little, make sure it's not indelicate. I see couples in therapy, and they'll use it as an adjunct to make sure their romantic life is better, and they use it twice a month. I'm not going to tell people not to do that. By the way, occasional social drinkers live longer than abstainers. Alcoholics live much shorter than both. So is there an argument to you for occasional marijuana use? Okay, it's still going to affect your brain and lungs, but make your own choice. If it facilitates you being able to have better romance with your spouse and you live together forever, no get divorced and your kids get screwed up, okay, I'm not going to argue with that. I've seen cases like that. Middle of the preach, I apologize. And okay, you've got time for questions. Anybody still awake out there? Welcome to ask questions. So. And Katie, how we do this? Here we go.
All right. Well, thank you, Dr. Malone.